NCLEX-RN Practice Exam 1. Question 1. A client hospitalized with severe depression and suicidal ideation refuses to talk with a nurse. The nurse recognizes that the suicidal client has difficulty A. Expressing feelings of low self-worth. B. Discussing remorse and guilt for actions. C. Displaying dependence on others. D. Expressing anger toward others. Answer D is correct. The suicidal client has difficulty expressing anger toward others. The depressed suicidal client frequently expresses feelings of low self-worth, feelings of remorse and guilt, and a dependence on others. Therefore, answers A, B, and C are incorrect. Question 2. A client receiving hydrochlorothiazide is instructed to increase her dietary intake of potassium. The best snack for the client requiring increased potassium is A. Pear. B. Apple. C. Orange. D. Banana. Answer D is correct. Answers A, B, and C are incorrect because they contain lower amounts of potassium. Note that the banana contains 450 mg K+. The orange contains 235 mg K+. The pear contains 208 mg K+, and the apple contains 165 mg K+. Question 3. The nurse is caring for a client following removal of the thyroid. Immediately post-op, the nurse should A. Maintain the client in a semi-Fowler's position with the head and neck supported by pillows. B. Encourage the client to turn her head side to side to promote drainage of oral secretions. C. Maintain the client in a supine position with sandbags placed on either side of the head and neck. D. Encourage the client to cough and breathe deeply every 2 hours, with the neck in a flexed position. Answer is correct. Following a thyroidectomy, the client should be placed in semi-Fowler's position to decrease swelling that would place pressure on the airway. Answers B, C, and D are incorrect because they would increase the chances of post-operative complications that include bleeding, swelling, and airway obstruction. Question 4. A client hospitalized with chronic dyspepsia is diagnosed with gastric cancer. Which of the following is associated with an increased incidence of gastric cancer? A. Dairy products. B. Carbonated beverages. C. Refined sugars. D. Luncheon meats. Answer D is correct. Luncheon meats contain preservatives such as nitrites that have been linked to gastric cancer. Answers A, B, and C have not been found to increase the risk of gastric cancer. Therefore, they are incorrect. Question 5. A client is sent to the psychiatric unit for forensic evaluation after he is accused of arson. His tentative diagnosis is antisocial personality disorder. In reviewing the client's record, the nurse could expect to find A. A history of consistent employment. B. A below-average intelligence. C. A history of cruelty to animals. D. An expression of remorse for his actions. Answer C is correct. A history of cruelty to people and animals, truancy, setting fires, and lack of guilt or remorse are associated with the diagnosis of conduct disorder in children, which becomes a diagnosis of antisocial personality disorder in adults. Answer is incorrect because the client with antisocial personality disorder does not hold consistent employment. Answer B is incorrect because the IQ is usually higher than average. Answer D is incorrect because of a lack of guilt or remorse for wrongdoing. Question 6. The licensed vocational nurse may not assume the primary care for a client. A. In the 4th stage of labor. B. 2 days post-appendectomy. C. With the venous access device. D. With bipolar disorder. Answer C is correct. The licensed vocational nurse may not assume primary care of the client with a central venous access device. The licensed vocational nurse may care for the client in labor, the client post-operative client, and the client with bipolar disorder. Therefore, answers A, B, and D are incorrect. Question 7. The physician has ordered dressings with sulfamylin cream for a client with full-thickness burns of the hands and arms. Before dressing changes, the nurse should give priority to A. Administering pain medication. B. Checking the adequacy of urinary output. C. Requesting a daily complete blood count. D. Obtaining a blood glucose by finger stick. Answer is correct. Sulfamylin produces a painful sensation when applied to the burn wound. Therefore, the client should receive pain medication before dressing changes. Answers B, C, and D do not pertain to dressing changes from the client with burns, so they are incorrect. Question 8. The nurse is teaching a group of parents about gross motor development of the toddler. Which behavior is an example of the normal gross motor skill of a toddler? A. She can pull a toy behind her. B. She can copy a horizontal line. C. She can build a tower of 8 blocks. D. She can broad jump. Answer is correct. According to the Denver Developmental Screening Test, the child can pull a toy behind her by age 2 years. Answers B, C, and D are not accomplished until ages 4 to 5 years, therefore, they are incorrect. Question 9. A client hospitalized with a fractured mandible is to be discharged. Which piece of equipment should be kept on the client with a fractured mandible? A. Wire cutters. B. Oral airway. C. Pliers. D. Tracheostomy set. Answer is correct. The client with a fractured mandible should keep a pair of wire cutters with him at all times to release the device in case of choking or aspiration. Answer B is incorrect because the wires would prevent insertion of an oral airway. Answer C is incorrect because it would be of no use in releasing the wires. Answer D is incorrect because it would be used only as a last resort in case of airway obstruction. Question 10. The nurse is to administer digoxin elixir to a 6-month-old with a congenital heart defect. The nurse auscultates an apical pulse rate of the nurse should A. Record the heart rate and call the physician. B. Record the heart rate and administer the medication. C. Administer the medication and recheck the heart rate in 15 minutes. D. Hold the medication and recheck the heart rate in 30 minutes. Answer B is correct. The infant's apical heart rate is within the accepted range for administering the medication. Answers A, C, and D are incorrect because the apical heart rate is suitable for giving the medication. Question 11. A mother of a 3-year-old hospitalized with lead poisoning asks the nurse to explain the treatment for her daughter. The nurse's explanation is based on the knowledge that lead poisoning is treated with A. Gastric lavage, B. Chelating agents, C. Antibiotics, D. Activated charcoal. Answer B is correct. Chelating agents are used to treat the client with poisonings from heavy metals such as lead and iron. Answers 1 and D are used to remove non-corrosive poisons, therefore, they are incorrect. Answer C prevents vomiting, therefore, it is an incorrect response. Question 12. An 18-month-old is scheduled for a cleft palate repair. The usual type of restraints for the child with a cleft palate repair are A. Elbow restraints, B. Full arm restraints, C. Wrist restraints, D. Mummy restraints. Answer is correct. The least restrictive restraint for the infant with cleft lip and cleft palate repair is elbow restraints. Answers B, C, and D are more restrictive and unnecessary, therefore, they are incorrect. Question 13. A client with glaucoma has been prescribed Therapeutic timolol eye drops. Therapeutic should be used with caution in the client with a history of A. Diabetes, B. Gastric ulcers, C. Emphysema, D. Pancreatitis. Answer C is correct. Beta blockers such as timolol Therapeutic can cause bronchospasms in the client with chronic obstructive lung disease. Therapeutic is not contraindicated for use in clients with diabetes, gastric ulcers, or pancreatitis, therefore, answers A, B, and C are incorrect. Question 14. An elderly client who experiences nighttime confusion wanders from his room into the room of another client. The nurse can best help decrease the client's confusion by A. Assigning a nursing assistant to sit with him until he falls asleep. B. Allowing the client to room with another elderly client. C. Administering a bedtime sedative. D. Leaving a nightlight on during the evening and night shifts. Answer D is correct. Leaving a nightlight on during the evening and night shifts helps the client remain oriented to the environment and fosters independence. Answers 1 and B will not decrease the client's confusion. Answer C will increase the likelihood of confusion in an elderly client. Question 15. Which of the following is a common complaint of the client with end-stage renal failure? A. Weight loss, B. Itching, C. Ringing in the ears, D. Bruising. Answer B is correct. Pruritus or itching is caused by the presence of uric acid crystals on the skin, Which is common in the client with end-stage renal failure? Answers A, C, and D are not associated with end-stage renal failure. Question 16. Which of the following medication orders needs further clarification? A. Darvocet 65 mg POQ 4 to 6 hours. PRN. B. Nambutal 100 mg PO at bedtime. C. Coumadin 10 mg PO. D. Estrace 2 mg POQ day. Answer C is correct. There is no specified time or frequency for the ordered medication. Answers A, B, and D contain specified time and frequency. Question 17. The best diet for the client with Meniere's syndrome is one that is A. High in fiber. B. Low in sodium. C. High in iodine. D. Low in fiber. Answer B is correct. A low-sodium diet is best for the client with Meniere's syndrome. Answers A, C, and D do not relate to the care of the client with Meniere's syndrome, therefore, they are incorrect. Question 18. Which of the following findings is associated with right-sided heart failure? A. Shortness of breath. B. Nocturnal polyuria. C. Daytime oliguria. D. Crackles in the lungs. Answer B is correct. Increased voiding at night is a symptom of right-sided heart failure. Answers 1 and D are incorrect because they are symptoms of left-sided heart failure. Answer C does not relate to the client's diagnosis, therefore, it is incorrect. Question 19. An 8-year-old admitted with an upper respiratory infection has an order for O2 saturation via pulse oximeter. To ensure an accurate reading, the nurse should A. Place the probe on the child's abdomen. B. Recalibrate the oximeter at the beginning of each shift. C. Apply the probe and wait 15 minutes before obtaining a reading. D. Place the probe on the child's finger. Answer D is correct. The pulse oximeter should be placed on the child's finger or earlobe because blood flow to these areas is most accessible for measuring oxygen concentration. Answer is incorrect because the probe cannot be secured to the abdomen. Answer B is incorrect because it should be recalibrated before application. Answer C is incorrect because a reading is obtained within seconds, not minutes. Question 20. An infant with tetralogy of Fallot is discharged with a prescription for lanoxin elixir. The nurse should instruct the mother to A. Administer the medication using a nipple. B. Administer the medication using the calibrated dropper in the bottle. C. Administer the medication using a plastic baby spoon. D. Administer the medication in a baby bottle with 1 ounce of water. Answer B is correct. The medication should be administered using the calibrated dropper that comes with the medication. Answers 1 and C are incorrect because part or all of the medication could be lost during administration. Answer D is incorrect because part or all of the medication will be lost if the child does not finish the bottle. Question 21. The client scheduled for electroconvulsive therapy tells the nurse, "I'm so afraid." What will happen to me during the treatment? Which of the following statements is most therapeutic for the nurse to make? A. You will be given medicine to relax you during the treatment. B. The treatment will produce a controlled grand mal seizure. C. The treatment might produce nausea and headache. D. You can expect to be sleepy and confused for a time after the treatment. Answer is correct. The client will receive medication that relaxes skeletal muscles and produces mild sedation. Answers B and D are incorrect because such statements increase the client's anxiety level. Nausea and headache are not associated with ECT, therefore, answer C is incorrect. Question 22. Which of the following skin lesions is associated with Lyme's disease? A. Bull's eye rash. B. Papilla crusts. C. Bully. D. Plaques. Answer is correct. Lyme's disease produces a characteristic annular or circular rash, sometimes described as a bull's eye rash. Answers B, C, and D are incorrect because they are not symptoms associated with Lyme's disease. Question 23. Which of the following snacks would be suitable for the child with gluten-induced enteropathy? A. Soft oatmeal cookie. B. Buttered popcorn. C. Peanut butter and jelly sandwich. D. Cheese pizza. Answer B is correct. The client with gluten-induced enteropathy experiences symptoms after ingesting foods containing wheat, oats, barley, or rye. Corn or millet are substituted in the diet. Answers A, C, and D are incorrect because they contain foods that worsen the client's condition. Question 24. A client with schizophrenia is receiving chlorpromazine thorazine 400 mg twice a day. An adverse side effect of the medication is A. Photosensitivity. B. Elevated temperature. C. Weight gain. D. Elevated blood pressure. Answer B is correct. Neuroleptic malignant syndrome is an adverse reaction that is characterized by extreme elevations in temperature. Answers 1 C are incorrect because they are expected side effects. Elevations in blood pressure are associated with reactions between foods containing tyramine and MOI, therefore, answer D is incorrect. Question 25. Which information should be given to the client taking phenytoin Dilantin? A. Taking the medication with meals will increase its effectiveness. B. The medication can cause sleep disturbances. C. More frequent dental appointments will be needed for special gum care. D. The medication decreases the effects of oral contraceptives. Answer C is correct. Gingival hyperplasia is a side effect of phenytoin. The client will need more frequent dental visits. Answers A, B, and D do not apply to the medication, therefore, they are incorrect.
Thanks for watching. Please comment, like and share.